I'm Dr. Seth Eberlin. I'm a board-certified plastic surgeon here in Walnut Creek, California, and today we're talking about brachioplasty, or an arm lift. Now, the reason that this is becoming a more and more popular procedure is two things. Number one, with the advent or the introduction of the GLP-1 agonist medications like Ozempic, people are losing more weight. And number two, the inner arm skin is notoriously thin. There's just not a lot of dermis, which means there's not a lot of collagen and not a lot of elastin. So as we age or as we lose weight, the volume reduces, but the skin doesn't kind of snap back with it. So we tend to get more laxity in that area. And the solution to this is usually to remove that laxity by taking the skin out. Now, first thing we always look at when somebody comes in and says, my arms bother me, is what type of procedure are we going to look for? Because doing a brachioplasty is a relatively involved procedure, and it does typically involve an incision that goes from your armpit all the way down to some point near your elbow, and that's just very dependent on where your laxity is. There's a few different variations of this, and we'll kind of address that a little bit farther down the video. When we're looking at this, we'll say, number one, is there enough skin laxity to necessitate a scar? And if there is that laxity on the entire arm, or is it just in the upper part of the arm? If it's just in the upper or more proximal part of the arm, we can do what's called a hidden scar brachioplasty, where you just have a little incision that sits up in your armpit. That lets me tighten up the upper third of the arm. Doesn't really do very much for this distal 2/3 or so down here. So that's a very specific procedure for a very specific patient, but it is really effective. So the first thing that we look at when somebody comes in is, which type of procedure are we candidate for? Once we kind of start to elucidate that, then we can look at, is our weight stable? If your weight isn't stable, if you're typically thinking, oh, I want to lose another 15, 20 pounds, then I would say let's hold off on this procedure until we get a little bit closer to your goal weight, because what we don't want to do is to adjust that skin to volume ratio. When we're going to do this procedure, I want to make sure that ratio is nice and even. And if after the procedure you lose a little bit more weight, well, then that ratio is not going to be even and the skin is going to be loose again, which we don't want. So we want to make sure that your weight is stable. The other thing that I spend a lot of time talking to people about is the scarring. Because once a scar is there, once an incision is there, you can't undo it. So it's really important to be very clear about where the incisions are going to be, how long they're going to be, and how long they're going to take to heal. Because if you put an incision somewhere and somebody doesn't like it, it doesn't matter how fantastic the rest of their arm looks. If they're unhappy with a scar, the procedure is not successful. So that's a real important thing. Once we have decided which kind of version of this procedure we're going to do, whether it's the traditional longer scar brachioplasty or that hidden scar brachioplasty, then we can talk about what recovery is going to be like. Now, recovery for both of them is relatively similar. And what recovery entails is, number one, compression. When your arm kind of goes through this procedure, it's going to want to swell. And on the other side of it, I've just tightened that skin up. So we're tightening the skin, your body's trying to swell against that, and it kind of turns into a little sausage. So our job is to compress that as effectively as we can to make sure the swelling doesn't get out of control, doesn't put too much tension on the incision, and also doesn't cause too much discomfort. There's a number of different kind of modalities that we can use to compress the arms, whether it's ACE wraps, whether it's kind of upper arm sleeves, or whether it's a true compression garment that we get through our medical device company. Any kind of combination of these works. It's just a matter of what feels comfortable for you and what's going to be best for your lifestyle. Usually I like people to wear those around the clock, call it 23.5 hours a day, for about 2 weeks. And then after those 2 weeks, we can slowly taper off until you get to the 4-week mark where you don't really need it anymore. That tends to be when the swelling is mostly resolved. Things are looking and feeling really good. However, that's when we really need to start paying attention to the incision. We obviously want them to heal perfectly. We want them to fade. We want them to disappear, and that takes some time. So usually from post-op week 2 to post-op week 8 is when our incisions in general are the reddest and when they're the bumpiest and when they're the most sensitive to sunlight. So even though underneath the arms, not a super sun exposed area, we still want to protect it either with sleeves, with sunscreen, with steri strips, with silicone sheeting, with anything that's going to protect that incision from the sun and also put a little bit of pressure on it. And that's where silicone sheeting or silicone gel comes in. The other really important thing is massaging. Massaging the incision helps to smooth it out faster. It also helps your body to resolve that swelling faster. It helps to kind of remind your body that there's fluid there, that there's something to take care of, and the more you do that, the faster we get rid of it. As far as the activity goes, for the first 2 weeks, I don't really want people doing too much arm-directed activity. You know, you can go about your normal life, you can brush your hair, you can brush your teeth, you can eat, you can do all that stuff. I just don't want arms going way up over your head, because once you start doing that, we're gonna put tension on that kind of the axillary portion of the procedure. And tension is the enemy of healing. Tension is what stimulates your body to produce too much collagen, which widens our scars and makes them thicker. So we don't want that. So for the first 2 weeks, I tell people you don't have to have dino arms, but 90 degrees is about as high as we want. After 2 weeks, we can kind of slowly start to stretch and get back to it. But as far as weightlifting restrictions, I don't really have a very strict set protocol for that, because everybody heals on their own timeline. So I usually tell people, listen to your body. If you're gonna do something and it feels really uncomfortable, or your body's just telling you, no, don't do that, well then don't do that. If you do something that feels fine, if it feels comfortable, if you don't notice any increase in pain, any increase in swelling, then that's a sign from your body that, hey, I think this is okay. Of course, this is all within reason. If you're somebody who tends to just push through things and say, it's fine, I'm gonna ignore it, don't do that. That's not listening to your body. So I really wanna make sure that we're not taking that too literally and saying, it's fine, I can work my way through this. Because there are some things that we can do if we push too far too fast that will actually slow down the healing process, because that's gonna create more tension, more swelling, potentially more bruising, and more work for your body to do to resolve all of it. Now, once we've gotten through that first month of recovery, usually patients are looking really good, they're feeling really good, everything's healing really well, then it's just letting your body take it the rest of the way. And it usually takes up to 6 to 9 months to get that final result. Now, going from 1 month to 9 months, that's a really big window. And it's not like anything big or crazy or dramatic happens in there. It's just little changes over time. And those little changes are typically the scar flattens out and fades. The swelling slowly resolves. Any little numbness or tingling that you have in this area from the nerves kind of waking up, that resolves. These are all things that the patients may or may not notice, but other people don't really notice very much, because all they're noticing is, oh my gosh, look how much better my arms look. You know, it's just being able to see the definition and the contour and all the little shapes that we like to see in shapely arms, as opposed to having kind of the waving wings, if you go to wave and you have all this stuff underneath there. Overall, this is a very effective, very predictable procedure. Patients tend to be really happy with it, especially once they're fully educated on the difference between that hidden scar brachioplasty versus the traditional brachioplasty, and kind of all of the the downstream effects that come along with it. One question I do get asked a lot is this going to come back? And I can say that I've been on my own in practice for almost 10 years, and I have never seen this come back, because once we restore that tension in the skin, once we get things put back to where they are, unless somebody gains and loses an extreme amount of weight, your arm is going to stay nice and tight and tucked up where we want it to be. The other question I get is, okay, so I'm going to have a scar that's going to go more or less from my armpit down to my elbow. Is it going to be really obvious? And there's been a lot of studies in the kind of plastic surgery literature about where to put that scar. Honestly, the easiest place to put it is right down the back of the arm, and that is a terrible idea. Because if you're wearing a tank top or a sleeveless shirt and you're standing with your arm down, somebody from behind is going to be able to look and see that scar. So what we want to do is we look at basically it's called the bicipital groove, or where your biceps muscle is. We go a little bit behind that, because if you're sitting talking to somebody with your arm at your side, you're not going to see it from the back, you're not going to see it from the front. The only time you will see it is if your arm is open more than 30 degrees or so, then yeah, you might get a little hint of it, but most of the time when we're talking, we're not kind of talking like this. So as long as we're keeping our arms in a reasonable position and we're not kind of showing people, it's a very well hidden incision, and the trade-off of having a nice tight arm is pretty much 100% worth it. If you have any questions about this or kind of any of our previous videos, please don't hesitate to reach out and keep an eye out for more.